let's talk a little bit about regulation of heart rate. There are numerous factors that can act on the SA node to increase or decrease one's heart rate. So there's something called autonomic regulation. And you have a cardiac center in your medulla oblongata, which is in your brain. And there is all kinds of things going on there. And basically that cardiac center receives input from baroreceptors in the aortic arch and the carotid sinuses. And this deals with your heart rate. This is how your heart knows the speed at which to contract and therefore beat, right? So there are also, it's affected by your emotions, your emotional state, and impulses from the cerebrum and the hypothalamus. So there are many, many factors that attribute to whether our heart is beating slow or fast. So you have studied the nervous system somewhere, and there are things, there are neurons that we say are sympathetic neurons, and they are in the cardiac center, and they cause your heart rate to increase. Fibers exit the spinal cord via the thoracic nerves to innervate your SA node. There is a secretion of norepinephrine, which can increase heart rate, and it also strengthens the force of the myocardial contraction. So not only is your heart beating faster, but it's contracting more strongly. And this could be stimulated by physical and emotional stress. You also have parasympathetic neurons in the cardiac center that would cause a decrease in your heart rate. These fibers exit in the vagus nerve and innervate the SA and AV nodes. And here is a secretion of acetylcholine, which would slow the heart rate. This is stimulated by excessive blood pressure and emotional factors, some of which could be something like grief or depression. At rest, your parasympathetic impulses predominate. Increasing cellular needs decrease the parasympathetic impulses and increase sympathetic impulses. Other factors that can affect one's heart rate is age. As we get older, your resting heart rate declines. Infants and children have a much higher resting heart rate than somebody who's maybe 60 or 70 years old. Females have a slightly faster heart rate than males. And the better physical condition you are in, the lower heart rate you will have. Extreme athletes or people that are long distance runners can have a resting heart rate as low as like 55 to 60 beats per minute. Temperature will increase the rate of your heart rate. Epinephrine will increase and strengthen your heart rate. And thyroxine produces a lesser but longer lasting increase in heart rate. calcium levels and blood potassium levels. So if you have low levels of calcium, that can slow the heart rate. Increased levels can increase the heart rate and prolong contraction. And then potassium, that should say increased levels, will decrease both your heart rate and the force of contraction. And low levels can cause abnormal heart rhythms. So again, you want everything to be in sync, right? You don't want anything to be too high or too low, because that is obviously then going to have a trickle-down effect and could affect many other parts of your body, right? So let's talk about the types of blood vessels that we find in and close to the heart. Blood vessels form a closed system of tubes carrying blood from the heart to the body cells and then back to the heart, right? So your circulatory system, your cardiovascular system, is a closed system, meaning nothing can get in or out, hopefully. So we have veins, we have arteries, right? And they have different tissues. They are composed of layers. So the walls of arteries and veins are composed of 3 layers of what we call tunics. You have a tunica externa, you have a tunica media, and a tunica interna. Okay, so let's start with the outermost, the externa. This is, it consists of a loose connective tissue that often merges with that of the neighboring blood cells, nerves, and other organs. This tunica anchors the vessel and provides passage for small nerves, lymphatic vessels, and small blood vessels that supply the tissues of the larger vessel. Then we have a middle layer, the media. This is usually the thickest layer, and it consists of smooth muscle, collagen, and in some cases, elastic tissue. The relative amounts of smooth muscle and elastic tissue vary greatly from one vessel to another and form a basis for classifying vessels, as we'll talk about when we get actually to the vessels. We have an entire part on just vessels. Then we have the tunica interna. This lines the inside of the vessel and is exposed to the blood. It consists of a simple squamous epithelial called the endothelium, overlying a basement membrane and a sparse layer of loose connective tissue. It is continuous with the endocardium of the heart. The walls of arteries have the same basic structure as veins, but there are a few differences. Arteries have more smooth muscle and a less elastic connective tissue. And this is because of what they do. So arteries are sometimes called the resistance vessels of the cardiovascular system because they have a relatively strong and resilient tissue structure. Veins possess valves, whereas arteries do not. And this is because we need to prevent backflow of blood in our veins. So here's a picture showing you these 3 layers. The artery and the vein do both have these layers, but as you can see, the veins have a valve that we do not see in the artery. Arteries carry blood away from the heart. Okay, remember that. Arteries away. They branch into smaller arteries, eventually forming arterioles. Those are the smallest vessels that consist of endothelium and a few muscle fibers. And they play an important role in controlling blood flow and blood pressure. Capillaries are the smallest vessels and the most numerous. Red blood cells can pass through only one at a time. The walls of endothelium it's thin. They have very thin walls, enough to allow exchange of materials between blood and cells. They are most abundant in active tissues, and they are less abundant in connective tissues. You have something called a precapillary sphincter, which regulates the blood flow into the capillary beds. The sphincter contraction inhibits blood flow. And when the sphincter is relaxed, it allows blood flow. So this is kind of a regulating system. And the blood flow can be intermittent, receiving blood only according to the needs of the tissues that they're serving. So when the tissue needs it, it will release. When the tissue does not, it will contract. Exchange of materials. Materials pass through the interstitial fluid as they move between the blood and the cells, right? So we know that oxygen and nutrients diffuse from the blood into the interstitial fluid and into cells, and carbon dioxide and waste diffuse from the cells into the interstitial fluid and into the blood, right? This is the system. This is what the blood is doing. It is carrying nutrients, waste, oxygen, all kinds of things back and forth to the corresponding tissues, organs, everything in your body. And we also have water being exchanged through osmosis. Remember osmosis? That is the movement of water across a semi-permeable membrane. Then we have veins. Okay, so we've talked about arteries, we've talked about capillaries, and then we have veins. They are relatively thin-walled and flaccid, and they expand easily to accommodate an increased volume of blood. That means that they have a greater capacity for blood containment than arteries. At rest, about 64% of blood found in the systemic veins, as compared to only 13% is found in the systemic arteries. So we have blood flowing from the capillaries into the venules. Venules unite to form larger veins, which in turn unite to form even larger veins. Then we have these valves that exist in the large veins to prevent any backflow, and they then aid in the venous blood return. Like I mentioned, veins hold about 60% of the blood flow at any given moment. And they can actually be a reservoir as well. You have sinusoids in your liver and spleen that actually are reservoirs of blood. Reducing venous volume can compensate for blood loss or increase in muscle activity. So different things happen as your body needs different amounts. And that is going to conclude this lecture. Please let me know if you have any questions.